So in this video, I'm going to be talking to you about a couple of cues that you can keep in mind as you execute glenohumeral controlled articular rotations, otherwise known as shoulder cars. And so when we go through these glenohumeral cars, it's very important to understand what motions are actually happening at the joint so you can start to toy around with the tension, but also understand how the positioning is going to dictate how much range of motion you have at each particular point. So to start, we're just going to go through one together, okay? So I'm going to be cueing as if I'm teaching a class or teaching somebody one-on-one. So you're going to start by we're going to start with the right hand or right shoulder. Left hand comes on the belly. That's to give you feedback to prevent you from rotating or compensating to the torso. It also gives you feedback if you are irradiating enough or creating enough tension. So you're going to externally rotate with the right arm. So your elbow pit is going to rotate forward and out along with your hand, and then you're going to bring your pinky in towards the midline. So now we're maintaining external rotation and adduction, and we're going to continue to externally rotate and adduct or bring that shoulder across the midline as we bring that bicep to your chin. Bring that bicep to the ear as you start to unwind, and when you get to the top, I'm going to turn around so you can see clearly. You're going to max out your flexion, but then start to rotate and create internal rotation at the shoulder by rotating the palm away from you, along with the elbow pit. You're rotating that elbow pit towards the floor as you keep your hand up high, and then you max out your internal rotation as you transition into extension. So if you're doing this right, you should be at glenohumeral extension with the palm of your hand facing away from you, or in this case, facing the camera. And then from here, you're going to finish with the palm facing away from you next to your pocket, and you're going to make sure you squeeze out whatever internal rotation you didn't get while you were in extension. Now from here, we're going to reach the fingers down as we come back. Reach with your thumb. Don't let that thumb point towards your midline. Keep it pointed behind you as long as you can. Then start to unwind into external rotation as you bring the hand up higher into extension. Now we are in horizontal abduction as we externally rotate and come up into flexion. Now that we're in flexion, that bicep is next to your ear. I'm going to take my bicep. I'm going to try and scrape my face and bring that bicep to my chin as I start to rotate my palm towards the ceiling. And I'm continuing to reach my arm across my body as I come down and finish at my side. So as you went through that controlled articular rotation for the glenohumeral joint or the shoulder joint, there are a couple of points where you have some freedom to toy around with your positioning to try and max out motion. But the one thing that I want to talk about regarding this particular exercise is the fact that it's a controlled articular rotation. So think about rotation being the main emphasis or focus as you go through this. In particular, internal, external rotation. Now, where you can emphasize external rotation is here at the start, where you can max out your starting external rotation before you go into adduction. You can also max it out when you're transitioning out of extension into external rotation and horizontal adduction, because at this point, you're going to finish here in flexion over your head. And for internal rotation, two main points. One is maxing it out when you start to transition into extension from an overhead position. This transition into internal rotation and extension, you want to make sure you visualize like you're corkscrewing your elbow. And the more you corkscrew your elbow, the more rotation is going to happen at the actual shoulder joint, not just the hand. That's a very common mistake a lot of people make. And then when you come out of that extension and internal rotation, this portion of motion right here is where you can squeeze out even more internal rotation. Just remember, there's a lot of slack being taken up here, so you can't get much motion here. But when you come out of extension, all of a sudden there's a bunch of slack being freed up where you can now squeeze out more internal rotation. So just keep that in mind, like, can you rotate a little bit more? Secondly, if you want to focus on flexion, extension, or abduction, adduction, you can take out some rotation to emphasize those planes of motion. A good example is actually, since we just talked about internal rotation and extension, if you're in extension and internal rotation and you really max out your internal rotation, for me, in my case, that's as far as I can go. But if I take out a couple of degrees of internal rotation, all of a sudden I clear a ton more range in this sagittal plane for my shoulder joint, in this extension plane of motion. If I unwind a little bit more and now my thumb is pointed forward, I have even more. So you can see how toying around with the level of rotation or level of movement at one plane influences motion at another plane. In this case, I take out some rotation, I free up some slack, and now I can go into more extension. That's going to be important for that transition because that's actually what you do. As you start to unwind out of internal rotation, you should be pushing into more extension because that's how you actually transition back up into flexion. The other case being here in horizontal adduction. If you start off with pure external rotation and you start to keep or maintain the palm facing forward as you come across the body, it's hard to reach across, especially if you're missing external rotation, because some of the tissue here that's being contracted by externally rotating along with the stiffness in the capsule might be limiting you from actually horizontally adducting. But then if you unwind a little bit, all of a sudden you can maintain much closer proximity of that elbow or that bicep to your chest as you come up overhead. So you have some freedom in terms of being able to toy around with these planes of motion. You just have to understand what you're doing and what joints are involved, what motions you're involving your shoulder joint in so that you can kind of mix and match your intention or effort. And that goes with you improving your ability to explore this joint. So I just kind of wanted to point that out. And I encourage you to actually toy around with that because that's the kind of stuff that you want to be able to do on your own if you need to adjust for whatever reason, or if you want to train a very specific quality in a very specific range of motion. So that's glenohumeral cars and how you cue them to maximize motion.